Hi, I'm Dr. Sunder. I'm doing a presentation here on vaping and pregnancy for new directions for women. If you like this, give me a thumbs up and please subscribe to our video as well. So let's move on. I'm going to be talking to you all about vaping and pregnancy. As you all know, this has been a topic that has both created a lot of controversy, but at the same time created a lot of engagement because there has been a perception that the use of vaping is somewhat different from the use of nicotine in pregnancy, which is that somehow it is less detrimental to use vaping as opposed to nicotine. So I'm going to go through what are the impacts of using nicotine overall, or what are called as nicotine-like products, electronic cigarettes, for instance, and what are the myths and perceptions, and what is the research surrounding its use, what are the risks and benefits, and what more needs to be done. So let's move on. Now, as you all know, this is a very special relationship on this planet, mother and the baby. And no one said this better than Willo Ln, that a mother always has to think twice, once for herself and once for her child. Independently, though, we might say that they are two different units. But when we have to treat them, we always have to think that whatever we do or don't do will impact both the mother and the child. What we also know from tremendous amount of research from the National Institute of Health, the Marseille Society of Psychiatric Disorders of Childbirth, the Postpartum Support International Research, and from multiple sources, including the American College of Obstetrics and Gynecology, that the use of drugs and alcohol, including nicotine in pregnancy, are associated with multiple problems, which we call also as reproductive toxicity. Now, this elegant slide gives you a perspective that there is an increased chance of birth defects, increased chance of stillbirth, increased chance of miscarriage, placental abruption, premature birth, low birth weight, and problems with respiration in a newborn child when tobacco is used on a consistent basis. So really, when we really think about this, we end up with some problems that have deleterious effect on both the unborn child, the fetus, as well as the newborn. What we do know is at any given time, about 7% of women tend to use electronic cigarettes that do contain nicotine, and that number seems to be less during the last 3 months of pregnancy. It's about 1.4%. So the understanding is that somehow e-cigarette use during pregnancy is safe, but as we can see, it is not, and we will show you some more data. Now, in this particular study, we are confirming what we have also just seen in the previous slide, which is that overall, during the 3 months before pregnancy, we have an increased amount of use. And then again, during the 2 to 6 months after delivery, there is an increased use of cigarettes, whereas the electronic cigarette use tends to be a little less. Now, another component that is important to recognize is the electronic nicotine delivery systems, also called ENDS, are a group of alternative tobacco products that were first introduced in about 2007. They include vaporizers, vape pens, hookah pens, and electronic cigarettes. Now, the solution in these electronic cigarettes is vaporized, and it contains nicotine, it contains artificial flavorings, propylene glycol, and glycerol or solvents. What we know is the perception is somehow e-cigarettes do not have the same exposure of nicotine as tobacco or cigarettes do, and which is not true at all. The reality is that they are comparable. What we also now are understanding is that these other additives in e-cigarettes, we really have not studied the impact of these on pregnant women and on the fetus and after delivery. What we do know from animal studies, will show you some data there. So again, coming back, what we are seeing is that the popularity of ends has steadily risen with the fact that now we have tobacco users and end users essentially growing to about 13% if you look at the data from 2013. Now, the tricky part here has been that before 2016, electronic cigarettes were actually not tested, approved, or regulated by the FDA prior to their release in the market. Packaging and advertising were not required to display the warning messages about health hazards, including pregnancy complications. Eventually, the FDA ruled in 2016 that they are subject to the same requirements as cigarettes, cigars, and other tobacco products. But then, as you all can see, the damage had already been done. So we've been flying under the radar to our detriment by not understanding the impact of the use of vaping and that it is very similar to the use of nicotine in pregnancy. So coming back to the thoughts that I had said about the perception of ends relative to the use of nicotine, that one myth that is circulated is that they are less harmful to the user than smoking traditional cigarettes, that they have fewer health effects and have several desirable properties. For example, that vaping is somehow a tool to quit using traditional cigarettes, or that it would help you to reduce the amount or number of cigarettes that you would smoke. Actually, what has been found is that a majority of women who reported using either tobacco, cigarettes, or ends, or both during their pregnancy, did not recall being screened by their providers regarding the use because it was assumed that somehow it was safe and that people would self-regulate. So what I would reiterate here is that the data tells us that vaping, in fact, is very similar in terms of the reproductive toxicity relative to the use of tobacco. Now, what we do know that relative to the other drugs such as heroin and alcohol, an abrupt cessation of smoking cigarettes or vaping during pregnancy is not that harmful in the sense that you do not have the same maternal stress due to nicotine withdrawals that you might experience with, for example, abruptly stopping the use of heroin or methadone. Now, one of the things that American College of Obstetrics and Gynecology has done is to encourage everybody to call in 1-800-QUIT-NOW. 1-800-QUIT-NOW. That is a helpline that allows women who are having difficulty to actually call and seek some help. If, on the other hand, a woman decides that she's unable to do it on her own, she can get in touch with trained providers and discuss the use of nicotine replacement therapy patches as well as medications. But each one of those has to be assessed on an individual basis because we don't know for sure whether or not in a particular case, nicotine replacement therapy presents risks to the fetus versus abruptly stopping it versus the use of nicotine. Because what we know is that many pregnant women also suffer from other conditions such as anxiety and depression. And oftentimes they are using nicotine or vaping in order to mask those symptoms. So untreated anxiety and depression is also a problem. And treatment also has its risks and benefits. And of course, as I mentioned, vaping and the use of nicotine also has its risks. So this has to be a risk-benefit decision analysis that has to be taken in conjunction with a provider on an individual basis. So What do we know about the e-cigarette effects on pregnancy, perinatal, and neonatal outcomes? What we do know is nicotine is a molecule that really can cross the placental barrier, and it accumulates in large amounts in the placental tissues, amniotic fluid, and also in the blood of the unborn fetus. And what we also know overall is that a fetus that is exposed to nicotine can actually suffer, as we looked at it earlier, from having less circulation to it. Therefore, this fetus can sometimes experience distress and even die in utero. There could be a termination of that pregnancy. And newborns can also sometimes suffer from anxiety. And developmental studies have shown that nicotine use in pregnancy could be associated with other problems, neurodevelopmental and behavioral problems in children, including attention deficits. I will say one more thing, that because electronic cigarettes and vaping products are new, there is still continuing and ongoing research, and there are few to know longitudinal data to really look at what are the perinatal and neonatal outcomes. From rat models and animal models, we know that intrauterine problems arise, such as increased inflammation, mitochondrial damage, oxidative damage to the DNA, and a premature decline in cardiac function in animal studies. So we know that the offsprings can actually suffer because of continuous use of nicotine. Overall, what can we do? So on the positive notes, now we know that the FDA has actually now started regulating vaping just in the same manner as cigarette use. So that's the good news. The other good news is that you have smoking cessation hotlines that are available to assist you in it, because it is indeed difficult to stop that habit. Finally, we also know that there are multiple behavioral interventions that can assist pregnant women from stopping smoking, and there are medications as well as other interventions that can assist us. And at New Directions for Women, we assist all women in multiple ways to not only quit drugs and alcohol, but also nicotine and vaping. So once again, if you liked this video, please subscribe and give me a thumbs up. Thank you so much.